Hi, my name is Andrea Benuelos, and I will be comparing and contrasting private healthcare versus universal healthcare. Private healthcare is available in the United States. It enables any person in the U.S. to buy their own health insurance according to what plan they can afford. Most people can only afford the basic healthcare plan, so it creates inequality between people. Some people cannot afford it and therefore do not have health insurance. This is unfortunate because medical bills and prescriptions are so expensive that if someone does not have health care, they do not get treated. It has been told that private healthcare system is business driven because insurance companies are looking for profit and charging more than what is needed. Everyone in the United States is at the mercy of these insurance companies because we need insurance in order to survive. It is unfortunate that it is expensive for this healthcare insurance, especially since most of us do not go to the doctors unless we absolutely need it. I know personally it's unfortunate that healthcare is needed because I rarely go to the doctors, but in order to go to CBU, I have to have health insurance. My dad is paying a pretty penny in order for me to have health insurance, even when I have only gone to the doctors twice in the last 3 years. The difference between highest level of care and the lowest level of care is astronomical. The highest level of care can give a patient the absolute best care. On the other hand, the lowest level of care is lucky to have some prescriptions covered by insurance. Universal health care is a system used in other countries like Canada and Europe. This system is used more as a right than a privilege. While this may seem like the better option, it is just as expensive because every person gets taxed to pay for their insurance. The government may fund this system, but everyone receives the same treatment and therefore everyone goes to the doctor frequently even when they do not need to. According to CBC News, public health care is the greatest impediment to ensuring that Canadians get quick access to the kind of medical services they deserve. This gives Canadians the access to insured health services on a prepaid basis without paying out of pocket. According to CBC News, the Canada Health Act guarantees that the conditions of health care are portable, universal, accessible, and free from extra charges. With the means of portable, any Canadian can move or visit any province, and insurance will still cover if someone were to fall sick. The downfall of universal healthcare is that everyone receives the same attention, so there is no way to buy your way to the front of the line. There are private hospitals in Canada, but it still covers services that are not covered by the universal healthcare. According to Lauer and Lauer, 9.5% of children under the age of 18 lack health insurance. Looking at the macro perspective, over 100 million Americans have no coverage at all. Looking ethnically, Asian Americans are more likely to have insurance, while American Indians are least likely. Fewer than half of American Indians and Hispanics only have a little more than half of Americans have health insurance. The lack of insurance causes some people to delay treatment or create their own treatment, which could lead to fatal results. The economic costs of healthcare in the United States are enormous. According to Lauer and Lauer, from 1960 to 2006, national healthcare expenditures rose from $28 billion to over $2 trillion, and they are still projected to reach $3.9 trillion by 2015. This takes a toll personally on family households. According to Lauer and Lauer, about a fifth of Americans live in families in which healthcare costs more than 10% of the family income. In addition, 7.3% are living in families in which the costs are 20% or more of the family income. Those families affected by mental illness prove that medical care costs are a heavy burden. According to Lauer and Lauer, the national cost of mental disorders exceeds $150 billion and may increase rapidly. The Obama administration is underway creating universal health care for the United States. His plan is to create a way for each citizen to have some kind of insurance. Obama believes that if every individual has health care, then their health will increase because they will have insurance. A number of nations have already implemented this into their countries, but other states in the United States, such as Minnesota and Massachusetts, are on board with Obama's reform. While this may seem like the way to go, there are challenges. These challenges include how to avoid high levels of out-of-pocket payments, how to ensure coverage for mental health as well as physical health, and who will pay for those costs of who cannot afford to pay for themselves. Some Americans believe that this issue should be dealt with at the state level, but unfortunately states cannot accept that responsibility. No matter what Americans think or feel, there will still be a change in healthcare at the federal level, and most importantly, there needs to be a change. Americans seem to have their own opinion on how healthcare systems should be. According to ABC News, 63% of Americans prefer universal health care insurance program over their current employer-based system. In addition, 78% are dissatisfied with the cost of the nation's healthcare system, and within that 78%, 54 are very dissatisfied. Within insured Americans, 82% can positively rate their healthcare coverage. Although Americans are dissatisfied with the cost of the system overall and their future expenses, they are still satisfied with their own current cost. The references that I chose to use were CBC News and ABC News, and I referenced the book too.